Hello, everyone, and welcome to our Monday Minute. Today, we're going to discuss the HHCAHPS survey. The reality recently for many agencies has been that the HHCAHPS scores they are receiving that in turn are being used to calculate their total performance score in the value-based purchasing expansion model are struggling. The HHCAHPS scores are relatively low, especially when you compare agencies' status of those scores compared to their peers versus their scores with OASIS or even acute care hospitalization. And so many agencies have begun asking, what do we do? How do we improve our HHCAHPS scores? How do we get more patients to participate, et cetera? So just a couple of things I wanted to emphasize and share with you regarding that today. As far as HHCAHPS outcomes are concerned, how many of you could say to yourself, we have done everything we can to educate our field staff on the content of that HHCAHPS survey and specifically focused on the questions that are going to impact our outcome measure calculations in value-based purchasing? The majority of you are probably thinking, she's lost her mind. We don't have time to educate on HHCAHPS. The reality is you don't have a choice but to have time. If you want to make it to the positive side of the value-based purchasing calculation, you need to see improvement in your HHCAHPS scores. And so when reviewing these with your field staff, you're not going to suggest that the patient that the field staff give the patient the detailed questions. They can't do that. However, you are going to need them to be able to understand the content of these questions. And in some cases, your field staff are going to have to change the way they communicate certain things to your patients, that they use the language that's being used in the HHCAHPS surveys. For example, one of the questions asks, when you call the agency for help or advice, most of you would probably admit that your patient doesn't call you and say, specifically say, I need help, right? They don't, because most of the time, if they say, I need help, they've already called 911 or they're already in the emergency room, right? And so being able to have that kind of conversation with your patients and use the term, if there's ever anything we can help you with, if there's ever any help that you might need that we can provide over the phone, that we can come out and do an additional visit, we need you to not hesitate to call us first. And so that would help a lot of things. That might keep the patient from calling 911 immediately or from getting up and going to the emergency room immediately if it is continuously ingrained in their minds that they need to call you first. And if you're using the terminology with them throughout that conversation, if you need help, if we can help you in any way, and continuously using that word help is going to help trigger in their minds exactly what's being asked on that survey when it asks about them calling the office for help or advice. Safety is another question that seems to somehow not quite resonate with the patients when you have not been using that terminology. For example, a therapist told me once that they had gone through the process of teaching the patient to make sure they use their walker when they ambulate, to make sure that they don't have loose rugs on the floor because they might trip and fall, etc. And then after 3 sessions of this, the therapist asked the patient if they felt like they had covered safety effectively. And the patient said no. And so my question to the clinician was, did you ever once say the word safety to your patient? And she didn't understand. And I'm saying literally using the word safety. Did you say to the patient, when you ambulate, you need to ensure for your safety that you are utilizing your walker? Make sure for your safety that there are no loose rugs on the floor. so that you might trip and fall. And so my point is, if we are not using the language that is included in the question itself on this questionnaire, then the patients are not going to be able to put together what's actually transpired in the home compared to the questions that they've been asked. I encourage you strongly to at least cover the exact questions that are used in the 5 outcome measure calculations for value-based purchasing in doing detailed in-services with your staff. Because again, if they don't know the content of the questions their patients are being asked, there's no way that you can expect those clinicians to impact the responses that your patients might have. If there's ever anything HPS can do for you, especially in assisting in this HHCAHPS situation, please don't hesitate to let us know. And I hope you have a fabulous week.